like we're slowing down on people joining now. We've got quite a few people on here. Brilliant. So welcome everyone to our first session in the Creating Connections sessions, looking at patient public involvement. A link into the chat for where all the other sessions, dates and how to book onto those as well. And I will hand you over to Felicity and Allison, who are going to talk to you about what involvement in research is. And if you could put any of your questions in the chat, seeing as there's quite a few of you, we'll try to answer those as we go through. So over to you, Felicity and Allison.
Brilliant. Thank you very much, Justine, and thank you all for coming along to this very busy session about patient public involvement in health and social care research. And as Justine said, this is the first in a series of presentations and sessions about different aspects of patient public involvement. Felicity and I are going to be given a kind of brief introduction, I guess. We have a presentation and then there should be time for questions and answers at the end. Because there's quite a lot of people here, it's probably easier if people put questions into the chat, but appreciating not everybody can do that. I can never do that if I'm using my phone. So if you can't, then feel free to kind of wave and then we can look for your questions there as well. I will ask everyone, if you can, to put yourself on mute as well, just to avoid any unexpected doorbells or dogs or etc. etc. So I'm going to, let me just bring up this presentation. Okay, so can everybody see that okay? Yeah, and everybody here okay?
Yes, all good.
Excellent. Well, we'll get started then. So my name is Allison Farnworth. I'm a senior research methodologist and patient public involvement advisor with the Research Design Service, which is based at Newcastle University, but is actually covers the whole region. And I'm presenting as a double act today with my partner in crime, Felicity, who I'll let you introduce yourself.
Morning everybody, or afternoon, sorry, Felicity Shenton. I'm the Public Involvement and Community Engagement Manager from the Applied Research Collaboration in the North East and North Cumbria. Okay, so just to explain to people where this training module has come from, there is a regional Creating Connections network in the North East and North Cumbria, which is public involvement, community engagement, PPI leads from all of the NIHR research infrastructure organisations. I can see a number of people from those organisations here on the call today. We have collectively been developing some research modules. Initially, they were going to be face-to-face delivery. That's an explanation to you about who all the various partnerships are within Creating Connections. And we've developed the series of modules, which Justine has just put a link to, and this is the first of those.
Sorry, my computer's playing up. Okay, so this is just what we're going to cover. So we're going to talk a bit about what patient and public involvement in research actually means, why it's important, or why we think it's important. We're going to talk about the national standards for public involvement. We're going to talk about what PPI might kind of pragmatically look like and what the challenges around it are. And we're going to round up by giving you an example of some PPI that I've been involved in around the area of maternity care research. And as I say, we should have time for questions at the end, but feel free to put them in the chat as you go because we can come back to them. Okay, so what is PPI? So PPI stands for patient public involvement, but you might see any of these other kind of acronyms come up when you're looking for this kind of literature around this kind of topic. So there's PPIE, which is patient public involvement and engagement, PPIE, patient care and public involvement, and PICE, public involvement and community engagement. And they're all slightly different, but they're all covering a similar kind of ethos, which is about involving patients and the public in research. And what it means is actively working in partnership with patients and members of the public to plan, manage, design and carry out research. It's research being carried out with or by members of the public rather than to, about or for them. And you can see by the words that I've highlighted there, it's very much about having a two-way collaborative process where you're working with patients and the public or the public to really work with the experience and expertise that they have as people who have lived with a condition or lived in a particular community or whatever, but they're bringing that expertise to the research team as an equal, and so that we all pool our expertise and experience to come up with the best research possible. And when we're talking about patients and the public, we include a lot of people actually. So people who use health and or social care services. It could be people who could use them either now or in the future. So it might be people who could use them but don't choose to for whatever, or unable to for whatever reason, or it could be that people who are going to be kind of become patients in the future. Carers, formal and informal, and people from organisations that represent or advocate for service users as well. So you can see from that, by that definition, pretty much anyone could fall into that category. It's worth mentioning what's not, because we do get people who get a little bit kind of confused about this. So it is, as I say, this kind of two-way process. It's not engagement and research, so that's something slightly different. So engagement is about letting people know about what you're doing or what the results were, increasing interest in that, and making that knowledge available really to the people who could best use it. So it's a slightly different thing, and Charlie Wilkinson actually is going to give a presentation about that later on in the year. It's not research participation, so that's about people who take part in a research project. Obviously that's really important also, but it's a slightly different thing, because within that, that's not necessarily a two-way process. That's more somebody taking part in something that a research team have set up. So it's a slightly different thing. Now, these three are kind of interlinked, so it can be sometimes that engagement can lead to involvement, or involvement can lead to engagement, and the same with research participation. What absolutely doesn't fit within this kind of ethos is tokenism. So the idea that you just kind of bring a public or member or a patient member into your team because you've been told that's what you're meant to do, and that you don't actually give them a real voice. That's actually really, it's a waste of time, first of all, and it's really kind of destructive and can be very dispiriting for the people involved. So it's absolutely not about tokenism. So why would we seek to involve patients and the public in our research around health and social care? And there's a few different reasons. Firstly, it's around transparency. So most healthcare research is funded by the public, either through taxation or through charities. And so if the public are contributing to it and funding, why shouldn't they see what we're doing with that money, and why shouldn't they have a voice in terms of what we do with that money and how we design that research and which research is funded? There's also something about fairness. It just seems like the right thing to do if people are, if people have health conditions or social care issues, then why shouldn't they have a voice in what research gets done? Again, if it's to improve their condition, then why wouldn't you involve them in terms of understanding what they think would improve their condition? And then it's about better design and more relevant research. So if we're designing a research project, it's really important that we make it as accessible as possible for people to be able, people who want to take part in that research, to be able to do so. And what you don't want is to come up with something like this representation here on the screen, or something that, yeah, somebody's made an accessible around, but it's actually not accessible. Nobody could ever use that. And you'd be surprised how many people design research projects that really are you know, that they exclude people incidentally because it just makes it too difficult for people to take part. So involving people when you're designing the research is a really good way to kind of avoid that. And also, in terms of relevant research, obviously, if we had an infinite pot of money, we would do all the research we possibly could, but we don't. So it's really important that when we do direct public money into these research projects, that we're answering the questions that are really going to make a difference to people's lives. And how are we going to know that unless we go out and ask those people and work with them to design these research projects? And ultimately, if you design relevant research, that's much more likely to end up in practice as opposed to research, which kind of, a researcher does it and then people say, well, so what? And then that has been a waste of money in that case. The other big reason, and this is not the reason to do it, but it is a reason, is that all the major funders, research funders for health and social care now require that you talk about what patient-public involvement that you've done, And it's a requirement, so that they're asking you what they've done. They're not asking you whether you've done it. It's be very, I can't even imagine a research project where they'd say, yeah, it would be fine not to include patients and the public in the work that you're doing. So even if researchers are doing very complex work, or say lab-based stuff, or research that's aimed at healthcare practitioners, ultimately you would expect that there's going to be some sort of public or patient benefit at the end, and so it's really important to explore the issues with them. And to give you an example, we have a lot of work currently been done around sort of artificial intelligence, and so people might say that's really complicated, it's really difficult to explain to the public, but actually there's a lot of ethical issues around that, and if you don't get that right at the beginning, then you're going to run into trouble during your project. So it's always really important to involve people. The funders will expect you to talk about what you have done in the development of your kind of grant funding application, and also what you intend to do if your project is funded. And they actually scrutinise the PPI elements of a funding application very closely, and it does actually count towards the final score of whether something is or isn't funded. And where people haven't really engaged with it, it sends a kind of bad message to the funders about how people value patients in the public. I work with something called the Research Design Service, and this is for researchers who are planning a research project, can come to us for help and advice. And the most common question that we get about PPI is like, where do I start? Like, what do I do? I don't know who to speak to. I don't know how to approach this. Unfortunately, there are a few resources available. Felicity, I'm going to hand over to you. Felicity is going to talk about the UK standards for public involvement, which do give some useful guidance.
Thank you. Can you put the next slide on, Allison, please? Sorry, thank you. So as Allison says, there are a set of standards that have been developed. Public involvement, community engagement is a social justice issue. So if we're doing health and social care research that is aimed at tackling health inequalities, it's really important that the voice of people living with health inequalities is present and part of the development of research proposals, the development of research processes, and that there is a strong element of empowering local people, local communities to be involved in research, the research cycle. And Allison will talk to you a bit more about that in detail. The standards have been developed with the full involvement of members of the public, service users and patients. So we have put a set of resources at the end of these slides with links to all of the documents that we talk about, including the standards. So I'm just going to talk you through these really quickly. Next slide, please. So inclusive opportunities, it's really important that we ensure that organise somebody at my door, that's typical, isn't it? Sorry, I'm just going to ignore it. That we create opportunities for all sorts of diverse communities, individuals to be involved in identifying research priorities, and then in identifying research proposals to address those priorities. And we need to make sure that we create opportunities that are inclusive of people who have language barriers, who can't access digital tools and resources, and that identify communities that are very seldom involved in research priorities. So you need to think about how inclusive your research opportunities are, and how inclusive are the opportunities for public involvement and community engagement. Next slide, please. We need to make sure that we're working together and that the partnerships are equal, and that there are opportunities for people to speak up about the things that are important to them, and that it's part of a two-way collaborative relationship, a partnership. Next slide, please. We need to make sure that the people who are involved in the research as PPI members have the proper training, support and development to ensure that they fully understand the opportunities that they're being given, that they are paid properly for their involvement in research, and there is national guidance on remuneration that's been reviewed in April of this year, and there's some really good information about the circumstances in which people's involvement should be paid for, suggested rates of pay and so on. It's an absolute minefield for lots of organisations, for universities, for health trusts, for local authorities, but it's absolutely crucial that we make sure that members of the public and community organisations are properly supported to engage as PPI members. Next slide. Communication is really important. We need to think about the various ways that we communicate with public members, service users, patients and carers, and that we think about people for whom English is not their first language, people who are British Sign Language users, and people whose literacy skills aren't very confident. So we need to think about written information, non-verbal information, online information, infographics and so on, to make sure that people know about opportunities but also fully understand the research environment in which they're working. Next slide, please. Impact. I am frequently reminded by members of the public who are involved in the ARC that one of the things they find most frustrating is giving up their very valuable time, their expertise, to be involved in a research study, either as a PPI member or as a research participant, doing a survey or being part of a focus group or a questionnaire. And the researchers then never coming back to people and telling them what happened at the end of the piece of research. So it's really important that people are fully informed at the end of the piece of research, what's happened to it, where it's been published, but also where the information is going for service providers or treatment providers, so that they have an understanding about what difference the research has made to them and to people who are also in their circumstances. And next slide, please. And finally, governance. It's really important that all of the research organisations, the ARC, the RDS, the universities, local authorities, involve members of the public and community organisations in their governance structures, so that the voice of members of the public is heard at all levels across an organisation. I know that there are members of the ARC Public Advisory Network here on the meeting today, and we have members of the public involved in all of the governance structures across the ARC, and I'm sure that's true also for big like Clinical Research Network, RDS and so on. It's really important that the voice of members of the public is heard at all levels across research. Okay, thank you. I think that's back to you, Alison.
Thanks, Leslie. So some of the kind of pragmatics, as I say, when researchers come to us about how they're going to approach that, and one of the first questions we get asked is who should we involve? So a few thoughts about that. So the first thing to say is just to remind you, when I went back a little bit, what this is not, and it's not research participation. So you're not governed by the same kind of regulatory constraints that you would be in terms of contacting somebody to take part in a research project. So it's absolutely fine to just go out to people and talk to them, and if they're happy to be involved in your research to kind of move that along. You don't have to have consent forms and approvals and things like that to be able to do it. In terms of who you would involve in your research projects, it really depends on what you don't know and who could give you that information. So if you were doing a project about, say, breastfeeding in Gateshead, it may be that is your question about how to improve rates, in which case you might want to talk to all kind of women who are of childbearing age around Gateshead, or is your question about what are people's experiences of breastfeeding, in which case you might want to target specifically women who have breastfed. And it may be that you include more than one population. So again, to give you another example, if you were doing a project around a screening a screening tool for a particular disease, you might want to involve people with that disease, but you also might want to include members of the general public to say, well, is this as one of the things that we could add to a screening program, is this useful, is it relevant? Because anybody might engage with the screening, if you see what I mean. So it can be more than one population. I'm not going to go into a great deal of more information about this particular aspect of it, but Jenny Hassenfuss and Hannah Gray are going to talk a little bit more about approaching and engaging members of the community in their session in October. So if that's something that's of relevance to you, do feel free to sign up to that. I am aware that there's a lot of people here who are patient public contributors themselves, and there are opportunities for people, because that's another issue, like how do people actually find out about these opportunities. There are platforms like the Voice platform, and we'll put a link to that towards the end of the presentation, where members of the public can put their name forward to say, I'd be interested in hearing about any kind of research any opportunities to take part from a patient-public involvement perspective, and then find out what sort of things are going on around the region. So there are opportunities to kind of link patients and the public with researchers out there. The same with the Research Design Service and the Applied Research Collaborative that Felicity works with. Felicity's already touched on the issue of inclusion. It's really important that when you're doing patient and public involvement, you're involving a wide range of people, and that you don't just kind of, it's very easy, I guess, to work with the people who put themselves forward, but actually you might get much more rich data if you also include people who might be a little bit harder for you to engage with, and it's often useful for that. There has been some work done by the National Institute of Health Research called the Include Project, which looks specifically at this issue in what they call underserved populations. So these are people who are not as represented in healthcare research generally, not just in terms of PPI, but also in terms of taking part in research as well. And the problem with that is if we don't include a wide variety of people in research, then the answers that you get are only relevant to certain populations, and it can increase the health inequalities that Felicity was kind of mentioning earlier. So it is really important. The Include website has a kind of training package within that. It's really interesting, so I would urge you to have a look at that if that's something that you're interested in. In terms of when you might involve patients and the public, as soon as possible, but at any stage would be our advice around that. So if you look at this as the research cycle of kind of moving from identifying and prioritizing ideas through to kind of developing the research, implementing and evaluating impact, patients and the public can be involved at any of those stages. So for example, with identifying and prioritizing, there's something called the James Lind Alliance, which you may have heard of. These are priority setting partnerships. It's basically groups of people who work together, and it includes patients and service users as well as professionals and academics, to look at specific issues and decide what are the most important issues within that population and what therefore should be prioritised in terms of which funding is developed and resourced. People can be involved in designing and managing research. As I've said earlier, it's really important from our point of view that patients and the public do have a say in what research looks like and what recruitment strategies are and what outcome measures you use. And I know that Clinical Research Network does a lot of work around that and actually has some patient champions working with them to help them around that area. Dissemination, so we would always advocate for disseminating beyond just the kind of academic and clinical channels. Obviously those channels are important in terms of letting other healthcare professionals and academics know about it, but obviously a lot of the patients and members of the public would like to know this information and can sometimes use that information. So, you know, you sometimes get patient kind of pressure groups putting pressure on people to provide particular services and resource. And if they have the evidence, if we make that evidence available to them, that's knowledge that they can use to make their case. So there's a lot of work goes into how we can disseminate to the public and patients, in what format, using plain English, trying to kind of break down some of the more complex issues around research into language that people can understand, and that's really, really important and something that patients PPI can have a really important role in. Yeah, okay. So in terms of how patients can be involved, it can vary and it will depend on your project. So whilst this is looks like a hierarchy, I guess it's not, because not all of these will be relevant for each research project, and not always, you know, patients and the public involved in research don't always want to have full control of a research project, so that's not always appropriate. But this just takes you up a trajectory from the bottom to the top with increasing levels of patient-public involvement, with none and just giving information at the bottom, which, as I've explained, is not really appropriate and wouldn't be accepted by the major funders now. Moving through to consulting with patients, planning jointly and moving towards a more kind of co-production type of model, right to the top where service users are in full control of the project and are essentially kind of contracting researchers to do that for them. We don't see that so often, but if we do, it's often from charities or advocacy groups that are putting forward their own research ideas and want to work with universities or hospital trusts to achieve that. And in terms of the kind of models of PPI that we see out there, so there are various ways of doing this, and it will be, as with everything, it will be dependent on what your research question is and what your patient public involvement members want to do. So it's not about us telling people what they should do, it's about people having an active voice, and one or more of these models might be attractive to them or not. So you can have patients or the public as a co-applicant. You can have members, steering group members. If you are, I would always advocate to have more than one, because it's quite a lonely place to be if you're the only patient public member. So that's something to think about. Some people go down a route of having a patient public advisory group, so they have a group of patients and or the public who they work with regularly throughout their project and feed into their steering group, so they have an active voice in shaping the research, and they don't necessarily all have to come to the steering group, which can be quite intimidating. You can have patient research ambassadors, experts by experience, involved in the delivery of research, analysis, dissemination. You can have co-researchers, so you can have patients and public as researchers, if they have those skills, or if you skill them up to do that and actually co-producing the research with you. You can have review panels, and you can have, as I say, research that's led by patients and members of the public. There is a bit more information coming out in further sessions. So Joe Lally is going to talk about co-production, I think, in January next year, and Justine Smith's going to talk about research champions and their role within the clinical research network in November later this year. So that's worth checking out if that's of interest to you. What's really important, and I haven't kind of mentioned, and I should have mentioned because it's pivotal really, is that PPI, you need to think of it as a process. It's not like a one-off event. It's not, well, we'll do our PPI now. It has to be integral to your research project. So whatever kind of model you choose, you should think of how you're going to embed it into your project, in the kind of development of your work, and also if it's funded, and perhaps even beyond, because a lot of research projects will then run into implementation strategies or further research, and members of the public can be involved right the way through that. So don't think of it as a thing to do, think of it as something to understand and work with your PPI contributors to embed into your research. So some of the challenges of PPI. So I'm not putting this up just to put you off, but I think it's worth mentioning that there are some significant challenges in terms of achieving meaningful PPI, and it's useful to be aware of some of these things, just so that if you come across them, you can start to think through how you're going to manage them. So one of the challenges is resource. As Felicity has touched upon, it's really important that you do resource your PPI activities and the public contributors who are getting involved. And that can be quite tricky for researchers if they're developing a funding application, so they don't actually have funding available at that time. There are resources available sometimes through organisations, certainly the Research Design Service, who I work with. If you are a researcher who's developing a funding application for a nationally competitive funding stream, we have a fund that people can apply to kind of help them out with some of the costs that are associated with it. So the sort of costs you might come across are like, you know, as well as reimbursing your public contributors, there's things like, you know, hiring a room or providing refreshments, paying for childcare if you're trying to bring people in who have children. You may need to pay for carers to be involved. You may need to think about travel, particularly if people have kind of accessibility needs. They may need an additional support around that. So there's lots to think about in terms of resource. So that can be quite tricky. Establishing and maintaining relationships. Okay, so as a researcher, sometimes you're going out, you don't know those people, you know, the people in the community yet, so it can take time to establish a relationship and develop a kind of a relationship of trust where people do want to be involved in what you're doing, and then maintaining that relationship, bearing in mind that if you're applying for research funding, it's not always funded straight away, and it can actually take quite a long time, so it can be a challenge to maintain those relationships. It takes a lot of time and effort to do that, so it's worth thinking about that in advance. There is a lack of understanding and evaluation around PPI. I think you'd probably agree that, that's still an ongoing issue, whilst we all we're very bought into the idea that PPI is something that we should be doing. We don't necessarily understand the impacts that it has because some of the PPI isn't evaluated. You're doing your research project, you're not necessarily evaluating your PPI, and that leads to some people being a little bit skeptical about whether it matters or whether it makes a difference. So that's something, there's quite a lot of work going on really now in terms of trying to evaluate PPI and understand a little bit better about what works and how it works and how we can support it more in the future. I mentioned tokenism earlier. Absolutely not okay to just have a PPI member, absolutely not okay to make decisions without your PPI members' involvement. All of those things are actually quite insulting to somebody who's giving up their time to get involved with your project. So if you are going to involve someone, make sure that you do that properly. Otherwise, you are risking having that person having a very negative experience and you not getting the best out of it, actually. So everybody misses out. Power imbalances. So we're talking here about patients and members of the public having a kind of equal say and an equal part in what's going on, but you can't ignore the fact that within society there are power dynamics that go on, and sometimes patients and the public might not feel comfortable to come into a room full of professors and medical consultants and feel free to have their say. They may feel quite constrained. So it's important to think about that, to think about whether that's an issue, and you can explore that directly with people. If it is an issue, what could you do to try and mitigate against that? Do you need to plan it in a way that patients meet separately, or do you need to work with people to kind of develop a more integrated approach where people do feel able to have their say? So that can be an issue. Accessibility and inclusivity, as Felicity has mentioned, that's really, really important, but actually is quite difficult to achieve. And again, coming back to the resource issue, can be quite challenging for researchers to be able to make sure that, for example, their PPI is available to someone that doesn't speak English or that has real problems getting into a hospital environment, etc. So those can be difficult to manage. Management of expectations. So as researchers, we're very aware that most research doesn't get funded. And that's really upsetting for the researchers involved. And it's not a reflection that the research wasn't worthwhile. It's just a reflection of the fact that research is a really competitive environment. And it's really important to speak with public contributors to help them to understand that as well, so that they're not feeling that they're coming into a research project that's definitely going to be funded and then think, well, what a waste of time at the end. If they feel like that, then maybe they don't want to get, if they know that that's the situation, maybe they don't want to get involved, and that's fine. But it's really important at the beginning to set out exactly where you are in the research cycle, what you're planning to do, what might happen. If it's not funded, what might you do next? Particularly, I'm thinking in areas where patients have worked with researchers to co-produce research. If that's not funded, people can take that really quite personally, and that's a difficult situation. Skills and confidence. So again, Felicity touched on this, so it's really important to make sure that if you're involving patients and members of the public, that they have the skills and the confidence to be able to do what you would like them to do and also what they would like to do within the project. And it might be that you have to do some extra work about helping them to understand the research itself and some of the technical aspects of that. Or it might be that you need to do some work, as I say, around dealing with the power imbalances that are going on. If you're involving patients as kind of co-researchers, for example, you'll need to do a little bit of work to make sure that they know what's expected of them and they have the skills to be able to do it. So again, that's something to think about. And if you're putting a funding application in, all of this needs to be thought through in terms of your costings as well. So make sure that your costing, the funders expect to see a good chunk of your funding application to be the money that you're requesting to be put over to PPI. So don't feel frightened about how much it might come out as. It's really important, if there is a need there, that you're resourcing it with your funding application. It can be hard to find a common language. I mean, I find this between academics and clinicians, to be honest. People speak different, they use acronyms. We've used some today, and please do correct us if there's anything that you don't understand, or just pop it in the chat and we'll explain it. But it can be really difficult to find that common language so that everybody can understand what's going on and everyone feels that they can contribute to it. But it is really important that you do that. And managing different perspectives can be difficult as well. So sometimes patients might have a very clear view about what they think should happen, and clinicians might have a very different view. And as a research team, you will need to be able to deal with that and help people to understand how all those different perspectives might be integrated into what you're going to do. Because it's not the case if you're doing PPI that everything that your public contributor says has to be done in the same way that you involve a qualitative researcher. You know, not everything they say has to be done. It's all things that are put into the pot, and then you come up with a research idea between yourselves. So it's about managing that, and again, it comes back, I guess, to management of expectations. COVID has provided a real challenge, well, challenges and opportunities, I would say, around PPI. So we, within the Research Design Service, we're obviously, as with the rest of the world, last March, were kind of confronted with a situation where everyone was sent home. A lot of the people who might get involved in patient public activities were in a situation where they might have been shielding as well. So there was additional concerns around that. So we moved very quickly to digital platforms and using Zoom, and that has worked really quite well for us. In some respects, that's been easier for some people because it means that they can do, you know, they can get involved from home. They don't have to, you know, make their way into a university, and which can be challenging. But in other ways, some people don't have access to that technology or don't know how to use it properly. And some people just don't want to. So we work with a group of young people and they don't like to be on video chat, which it's just a thing with young people. I've got a 12-year-old at home, he's exactly the same. And so we've had to come up with different ways of like putting up message boards where people can add comments that way. And again, it's about working with the communities that you want to engage and involve to find out what's suitable for them, what would work for them, and what would allow them to be able to kind of contribute. And then the last bit, I've just put ... because this is not exhaustive and it will depend on your community. There will be specific issues in different communities to think through, but it's just really important to be aware of some of the challenges and think them through before you start to engage, and then continue to look for those and manage them as you go along. So I'm going to give you a case study. So in my other job, I'm a research midwife, so I'm involved in a lot of reproductive health and care research, and some specifically around maternity care. And we had some real issues in involving pregnant women and new mums in the research that we were doing from a PPI perspective, for a lot of reasons. And as I say, they can be context specific. That's going to be different reasons. So from a maternity perspective, what can be challenging is that these women are generally quite busy and they're pregnant, but they're often working. They often have additional caring responsibilities. They're fitting in antenatal appointments. And so asking people to come along to a steering group meeting every 2 months just didn't seem to work. People would sometimes be interested for a while, but then would kind of drop out because they had other commitments. Obviously, new parents can barely remember their own name for a little while, never mind get involved in the kind of activities that we might ask them to come up to the university and do, so that's difficult. Some of the areas that we look at in maternity are quite sensitive and challenging. So we have babies who are unwell, and that's a really sensitive and difficult topic for people to kind of talk about within a formal university environment. If that was what, if you were inviting somebody into a PPI session. And then one of the clearest thing that we have as an issue is that pregnancy is time limited. So people are pregnant for a short amount of time within their lives, and they're really interested in the pregnancy and what's going on and some of the research that we're doing. And then, their babies grow up and they become less interested. They're not in that kind of baby phase of their life anymore. And it just becomes less relevant to them. And when things become less relevant, you get less engaged and less likely to want to get involved. Now, given the life cycle of a research project is, realistically often like 3 to 5 years. It would be not unusual from having an idea to getting it through to the final stages, and even that, you know, often it's longer. You know, you're looking at women who are pregnant at the beginning actually having a child at school by the end, and how interested and engaged are people, and our impression was that not really, and that wasn't their fault and it wasn't our fault, and it just made it really difficult. So this kind of might be a traditional model of PPI where you invite people along to a university building and ask people to come along and contribute as a public contributor. But this, again, really difficult for new parents who've got little babies and buggies and older children, and it just wasn't working for us. So we worked with and so we did think about, yeah, we could invite people in, just say, just bring your baby. It's not a problem to us. We're, you know, I'm a midwife. I don't mind to see your baby. But actually, to be someone like this, to come along and bring your baby and breastfeed amongst, you know, a group of other people who are trying to do that, who are doing their work, you need to be pretty confident to be able to do that. And that really would be quite exclusive to some people. And as we've talked about before, sometimes the way you design research can put some people off and make certain communities or certain types of people less able to be involved in your research. So that wasn't really a very viable solution for us. So what we did is we looked out into the community. I'm a mum, you know, I've got a son, and I know for a fact that there are groups of women, new mums and pregnant women, meeting all the time across the community, and baby groups and antenatal classes and things like that. So we thought, rather than asking people to come to us and to get involved in the PPI that we're designing, why don't we go out to them and see how that could work? And what we did was we identified a fantastic lady called Janine Smith, who has her own kind of pregnancy and birth practice. Now, she's not a midwife, she is a layperson who works with women during pregnancy and afterwards. And she does like baby groups and baby massage and all sorts of things like that. And she knows a lot of, she's working with pregnant women and new mums all the time, and she has a really good network. And we spoke to her about her research, and she was very keen to support us and to see how this could work. So she now actually has a research section on our website that people can look on to see what's happening. And what we started to do was to have, instead of getting women to come along to researchers, getting researchers to go along to women. And so researchers go along to this kind of baby group and chat about whatever it is that they want to chat about, and get some really useful feedback from the women. As you can see, or as you can guess from this, it's a pretty noisy environment. There's a lot of children and toddlers around, but the facilities are there for women. It's really easy. It's in the local community, so it's easy for women to get to. They can feed their babies, they can play with them on the floor, we can give them refreshments, and nobody's kind of sitting there for an hour feeling thirsty and stuff like that. So this was a much better model. And what we found was that by running a series of these sessions, so we've done, I think, about 20 plus now, researchers can come along, and it means that they're speaking to a different group of women each time. So it gets past this issue of the timeliness, because what we're saying, for this population, it's probably not realistic to have one woman who will follow you all the way through, but there's no reason why you can't keep going back to different groups of women and engaging them as you go through, if that's what women need and if that's what's going to work within this context. So the kind of things that people have done, the researchers have done within this, are talking about what are priority research areas, what do parents find important. They've talked about what their recruitment strategies are. So if they're designing a research project, how are they going to communicate that to women and new parents? Where should they go? When should they give them information? What information would they want? Refining research questions. So some people have gone with one research question and come away with a different one, because women have said, well, that's not actually the issue. What the issue is this, and how to refine that. Reviewing materials developed during the research. So one of my research projects, I was designing a kind of infographic about induction of labour. So women worked with me to say, right, that works, that's attractive, that doesn't make sense, etc. So that we made that a lot more lay friendly. Informing strategies for invasive research and sensitive topics. So we do have, as I say, there's some really sensitive topics, and recently we've been doing some research around miscarriage, and we're able to do that not within that baby group setting. We actually did that online. we're doing them all online at the moment, as you can imagine, but we will go back to the baby groups eventually as that kind of comes back online. And identifying opportunities for further involvement. So some of the women who've come to the sessions have said, actually, I would like to know a bit more about it as your project progresses, and I might want to get even more involved. And some people have become co-applicants, some people have joined steering groups. And again, that's up to the women whether they find that's something that's of particular interest to them that they want to follow up. But there's no obligation on the part of the women who are attending these sessions. And it's not just about the researchers and what they get. There's actually a two-way process here. So we also did a session that was just about the sessions, if you see what I mean, to ask women what they thought of it and where we could improve it and what they got out of it, if anything, and what they didn't get out of it. And a lot of women had some really nice things to say about it. A lot of people saying it's a nice social environment. It's interesting and stimulating for them. You know, sometimes when you've got a new baby, you don't really get much chat. So it's nice sometimes to find out what's happening around the region and being part of the conversation. One woman said, you know, when all these ideas are being thrown around, it's nice for people to feel that they have a part in that and they have a role in that if they want to. And it's just a bit different, something different for them to do. And it's in this informal, relaxed, chilled environment, so people don't feel under pressure and they don't have to get involved any more than they want to. I should say as well that these sessions are specifically set up as research sessions, so we're not just charging into a baby group where women are like trying to discuss, you know, what's going on in their lives. These women know when they come along to them that we are going to be talking about research. And for our next steps, we want to expand into different communities and networks. So this is based in North Shields, but we would like to kind of expand that opportunity out to people across the region, because everybody should be able to have a voice. We want to expand into different age groups and health and social care issues. And by age groups, I'm talking about the babies, actually. I should have made that clear. But we have had researchers doing work with preschoolers. And of course, a lot of the women coming along to baby groups also have preschoolers. So we've done a couple of sessions that have involved parents of preschoolers, which has gone really well, and different health and social care issues. So as I say, we've done some work around miscarriage, which is a particularly challenging area. We've also done groups where people have had previous pregnancy losses and things like that. So we are completing further evaluations, so we have done some evaluation with the women kind of qualitatively, but we're going to do some more survey work, but also with the researchers as well. So we're making sure that this is kind of evolving, and it is evolving in the best way possible, and increasing capacity across the region to be able to deliver these sessions. So at the moment, I facilitate, or one of my colleagues facilitates these sessions, but we would like it so that other people kind of understand the setup and are able to do that and don't feel reliant on us, basically. And so that even you know, if baby groups say, well, actually we want to get involved with this, that they could come forward and take charge of that. We don't necessarily want to be in charge of it. We're happy to work with people. And what we've learned from this is that there are real benefits to involving patients and the public in research, and they accrue to everyone. So not just the researcher, the public contributors get a lot out of it as well. Going out into communities and tapping into existing networks is really useful, and it allows those public contributors to meet you on their own turf. So you're going to them, you're in their environment, they're comfortable already, and I think that just creates an environment where people feel more able to talk or even to challenge you on what you're saying. Finding community leaders and working with them is really effective for us. So finding Janine was a masterstroke. So you know, Janine knows lots of women. So if we say, oh, we're looking for women who have had a baby during the pandemic, she'd be like, right, okay, I know XYZ person. We can kind of target who we're asking about this. So that's really helpful. Researchers and the public contributors sometimes need support to get meaningfully involved. So it is really important that you have a facilitator there, I think. Sometimes people can be quite quiet and can benefit from somebody kind of facilitating the conversation if there's pauses. And something to mention as well, and I don't know from the public contributors who are present here today, the researchers are really nervous about this often. They're not used to this environment where we're flipping the kind of power dynamic. And I've had really quite senior researchers and senior healthcare professionals be really nervous coming along. So we're holding hands on both points. just to make sure that people get the best that they can out of it. We don't want a difficult conversation. We want people to get the best that they can out of the sessions. The challenges, as I say, are context specific. So we have some particular challenges around maternity, and you're constantly learning. So as different research topics come up, we find different things that we need to be aware of, and we're trying to document that so we don't lose that learning along the way. And maintaining relationships and arranging these meetups can be time and resource intensive. So we work with Janine and we reimburse her time for doing that, which is like a godsend from our point of view. But it can be tricky to be able to do all of this if you're kind of doing it on the side of your full-time job. But it is something that needs to happen if you want to kind of get involved with something like this. So I think we're coming towards the end of the presentation now. So these are just some useful resources. So I've mentioned a few times the Research Design Service, who I work for. We have a website which is on here, and we'll share these slides afterwards, so you can kind of just click on these links directly. But we have a website which has a specific tab on public involvement, which has links to lots of different resources, and also information about our consumer panel. So within the RDS, we have a group of research interested lay people who work with us to kind of work with the researchers and review applications. And we're going to be sometime quite soon, we're going to be putting an advert out for more people to get involved with that. So look out for that if that's something that you think you might be interested in, and please do contact us if you'd like more information about what that would involve. I mentioned Voice earlier. This is a platform where the public can kind of put their name down to find out more about research happening in the local area. Well, not the local area, it's actually national now, but so that's something you can explore and tap into. If you're a researcher, you can apply to this and kind of put a shout out, you know, this is what I'm looking for. I'm looking for people with this particular experience to get involved in my research. As a public member, you can say what sort of things you're interested in. And there are also, as I say, at the RDS on the right there, we've got the consumer panel, and there are other things around the region where nationally, in fact, where you can get involved if you would like to. Felicity's mentioned the UK standards for public involvement, and the kind of we would advocate, if you are a researcher, to like really have a good look at this and understand it. If you're writing a grant application, it's really useful to be able to cite that you understand this and that you're planning your PPI activities around these standards. It's an expectation. There used to be something called NIHR Involve, which had an awful lot of information on there about PPI, and that's now shifted over to something called the Centre for Engagement and Dissemination, which does not have a website just yet, but if you Google that, some documents come up, and the Involve website is still there, and it's got a sign on saying it's no longer actively updated, but they do still have quite a lot of information on there that you can tap into. That's really useful if you want to know about specific aspects of PPI. Some more information there, again about the payment guidance that Felicity mentioned, something about involving children and young people if that's an area that you're interested in, and planning for impact, which is really important as well from an NIHR point of view. And then Justine has also already mentioned that we have upcoming sessions, and some of these, well, all of these touch on things that we've mentioned in this introductory session, and would be really worth getting involved with if or attending on your behalf if you would like to know more about these specific aspects of PPI, and that they all have, I believe they all have space left in them to sign up to that. So that's the presentation. I'll just stop sharing. It's a whistle-stop tour of PPI. It's by no means all there is to it, and I'm sure there are a lot of people here with a lot of experience of either being a public contributor or being a researcher or clinician involved with patients in the public. So Felicity and I are more than happy to chat through questions if anyone has them.